You've got statins for cholesterol and warfarin for blood clots. They are two of the most common prescriptions in the entire world. But what actually happens when millions of people take them together every single day? Well, that's where things get really, really interesting.
So what happens when these two pharmacological heavyweights meet inside your body? The answer is this fascinating story of competition, genetics, and a surprising twist that shows just how complex our bodies and the medicines we put in them truly are.
Okay, so let's meet our two main players. On one side, you have statins, these blockbuster drugs designed to lower cholesterol. And on the other, you've got warfarin, a really powerful blood thinner that prevents dangerous clots. Separately, they are absolute lifesavers, but together, they're about to start competing for the exact same resources inside your body.
To understand this competition, we need to take a little trip inside the body's main drug processing facility, the liver. I want you to think of it like a really busy factory, just working 24/7 to break down and clear things out of your system.
Every single drug you take eventually passes through this incredible organ. Its whole job is to metabolize them, to chemically change them so they can do their job and then be safely flushed from your system. And just like any good factory, this one has a very specialized workforce. It uses these proteins called enzymes, which act like tiny workers on an assembly line, and each one has a very specific job to do. For drug metabolism, these enzyme workers are absolutely critical.
Now, the star worker in our story today is an enzyme called CYP2C9. Let's just think of it as the warfarin specialist. Its main job on the factory floor is to process warfarin, making sure the drug's level in your blood stays within a really narrow, safe, and effective range. And here is where the plot thickens. Statins, as it turns out, aren't so simple. Once they're in your body, they exist in two different chemical structures, an acid form, which is the active cholesterol-lowering version, and a lactone form. And believe me, this seemingly tiny detail makes all the difference. And here's the proof, straight from the lab. What you're seeing here is what happens to our enzyme worker when different statins get added to the mix. Just focus on that black line. That's the lactone form. See how it just plunges downwards? That means it's a powerful blocker, and it's effectively shutting down the very assembly line that processes warfarin. So, here's the bottom line. When the statin's lactone form shows up, it basically hogs the CYP2C9 worker. The enzyme gets so busy dealing with the statin that it can't do its main job, which is processing warfarin. This creates a massive backlog. Warfarin doesn't get cleared from the system, and its concentration can build up to potentially dangerous levels, which really increases the risk of bleeding. But wait, the story doesn't stop there. This interaction, it isn't the same for everybody. It turns out your own genetics play a huge role in determining just how risky this combination can actually be. I mean, why is it that one person can take both of these drugs with no problem at all, while another person might face a really serious complication? The answer, as is so often the case in medicine, is written in our DNA. It all comes down to a common genetic variant known as CYP2C9*3. People with this variant have a slightly different blueprint for building that key enzyme worker. And the result is a version of CYP2C9 that is just naturally slower and less efficient at its job from the very beginning. So for somebody with this genetic makeup, their warfarin processing factory is already working at a slower pace. Then you add in the statin lactones, which are blocking the few efficient workers they do have, and the backlog effect gets dramatically amplified. It's a total double whammy that can significantly increase the risk of over-anticoagulation and serious bleeding. Okay, so we've seen how statins can interfere with warfarin. But this is where the story takes a truly unexpected turn. It turns out statins aren't just getting in the way. They have their own secret life as anticoagulants. This is what researchers call a pleiotropic effect, an action that goes way beyond the drug's primary purpose. So beyond just lowering cholesterol, statins have a direct impact on the body's entire system for forming blood clots. What you're seeing here is essentially a multi-pronged attack on the body's entire clotting system. Instead of just one action, statins are interfering at almost every single step, from the initial spark that starts a clot all the way to the key enzymes and factors that build it up. They are systematically weakening the whole process. And it doesn't even end there. They also target platelets, those tiny cells that act as first responders rushing in to plug a wound. Statins actually make them less sticky and less likely to clump together by tweaking the chemical signals that control them, so they're hitting the clotting system from two completely different angles.
All right, so let's recap. We have a drug interaction based on enzyme competition, we have a genetic component that magnifies the risk, and now we have this surprise anticoagulant effect from the statin itself. Let's try to pull this all together and see what it really means.
You know, this quote from the research just sums it up perfectly. The effect of statins on blood clotting isn't just some random side effect. It's a specific, powerful action that messes with both the chemical cascade and the cellular functions involved in forming a clot.
So, the huge takeaway here is this: our bodies are these deeply interconnected systems. A drug we take for one specific reason, like lowering cholesterol, can set off a whole cascade of other, completely unexpected effects. It's just a powerful reminder that inside our bodies, everything is connected.
Which leaves us with a final, really fascinating question. If a drug is common and as well studied as a statin has these complex, hidden blood-thinning properties, what other secret abilities might be lurking in our medicine cabinets, just waiting to be discovered?